Hello, my name is Sharon and I'm one of the respiratory nurses. This session is all about medications. We're going to talk about the role the different medications can play in helping to manage lung conditions, and we're then going to go on to talk about inhalers and the importance of a good inhaler technique with a couple of videos that will show you how to use your inhalers just to make sure you're using them correctly. The types of medications we're going to talk about. First of all, we're going to talk about inhaler medicines, all the different medicines that are inside your inhalers. We're then going to go on to talk about nebulizers, nebulizer therapy. We're then going to talk about some tablets, the common tablets that are used with people with lung conditions. We're then going to talk a little bit about oxygen therapy and how oxygen might be used to help people. And the last tablets we're going to talk about are nicotine replacement therapy. There's some tablets that can really help people if they haven't managed to give up smoking. So if you're still smoking, please do take a look at that session. So the first group of medicines we're going to talk about in a little bit more detail are inhalers, the type of medicines that we use in inhalers. We use inhalers for lung conditions because they're really good at getting the medicine from that inhaler straight into our airways in our lungs where we need it most. And remember, the airways are the tubes that are taking air from the outside straight through into our lungs. So let's have a look at the lung in that airway in a little bit more detail. The airway on the right, you can see is quite a clear airway. It's got a nice relaxed muscle around the outside of the airway, and it's got a nice smooth lining on the inside that's not at all inflamed. So that airway is not experiencing problems from a lung condition. The airway on the right is somebody who's experiencing problems with lung condition. There's the muscle on the outside of the airway that's got tighter, that's constricting that airway and making it harder for the air to get through. The inside of the lining, you can see, is a little bit inflamed, and it's also producing some mucus, so it's much harder for that air to get through, and that's what causes that breathless symptom that we can suffer from with a lung condition. So we're going to talk about some of those medications that can help in those inhalers, get into those airways and help with that condition. There's lots of different inhalers out there. They come in lots of different colours and shapes and devices. But we're going to focus at the moment on what's in the medicines. But just as a reminder, at the end of all of this session where we talk about medicines, we've got those inhalers just to check your inhaler technique, because that's also really important in delivering the medicine. So the first medicines that we're going to talk about are bronchodilators. Now, if you remember the airways that we just showed you on the screen, this was the nice relaxed airway with the nice relaxed muscle and that clear inside airway. This was the airway that had the tightened muscle around it. Now, the bronchodilators that are in your inhalers work on that muscle on the outside of the airway, and they aim to relax it and open it up so that air can pass through the airway more easily. The bronchodilators, there's two main bronchodilators that we use in inhalers. The first bronchodilator is called a beta-2 agonist. And what that does is work on little receptors in the muscles of the airway and encourages them to open up and just relax so that you get that air down and you feel less breathless. The second bronchodilator has the same effect, but it works slightly differently. It's called an anticholinergic, and it blocks a chemical reaction. The chemical wants to release and tighten up that muscle. It blocks that action, an anticholinergic. So again, the result's the same. It's keeping that airway open and making you feel less breathless so that you can do the things you want to do. So the first inhaler we want to talk about that's got the bronchodilators in it is called a short-acting therapy. It's a short-acting inhaler. So it's not something that's designed to use on a day-to-day use generally, but it's a rescue medicine. It's something you think, I'm having a bad day today, I'm feeling a bit more breathless, or I'm going out with the grandchildren, I've got a lot of work to do today, and you know it's going to challenge those airways a little bit more. So you might be something that you look for to relieve that extra breathlessness that you might be experiencing. It can have either of those types of bronchodilators in them, but again, the effect's the same, to open up this muscle on the outside of the airway. It's a short-acting one, which means that when you take a couple of puffs of that inhaler, it's probably going to last about 4 hours, maybe up to 6 hours as an extra relief. It takes about 5 to 15 minutes to work, so short-acting, but also quite fast-acting. Over and above that, it could also be something you look for if you're having potentially a flare-up, a worsening of your condition, a chest infection, an exacerbation, when you're thinking, do you know what, I'm feeling more breathless today, I'm feeling a bit unwell, I think I might be brewing a chest infection, and we're going to talk about that in a little bit more detail in a later session, but this might be one of the first medicines you reach for. You might think, right, I'm going to take a little bit of my extra rescue medicine, take it, and just help with that extra breathlessness that I'm experiencing at the moment. And it might be useful for you to take it 2 puffs 4 hourly over the duration of the day. As I say, we'll talk about that in a little bit more detail later. Side effects from bronchodilator therapy. They can make your pulse race a little bit. They can occasionally give you some palpitations where you can feel your heart racing a little bit. And they can give you a headache. They're generally really well tolerated, but if you do get problems and you think you're experiencing side effects that are troublesome, then please do talk to your GP, your nurse, your physio, the pharmacist, a healthcare professional. Have a chat with them and see if they can help you. So the next inhaler therapy we wanted to talk about with the bronchodilators in there is a long-acting bronchodilator. So this forms part of the maintenance therapy inhalers. And this is something you will be taking or prescribed on a day-to-day basis. It's probably going to be a morning and evening inhaler, so you'll take it twice a day, but there are also inhalers out there that you can now use once a day, so it's very much depending on which one you've been prescribed. But it's got a long-acting bronchodilator in it, so that's going to keep your airway open for 12 to 24 hours. And it's something you take day to day, whether you're having a particularly bad day or not. This is overriding all of that and just a day-to-day medicine. There are also inhalers out there that have got both of those dual bronchodilators in them. So what I mean by dual bronchodilator is it's got those 2 types of bronchodilators in it that are working together to open up that muscle on the outside of the airway. So you might have one of them in an inhaler, or you might have both of them in an inhaler. The side effects from them are very similar to the short-acting bronchodilators. So sometimes you can experience a headache, the racing pulse, palpitations. It can also cause a bit of a dry mouth, one of these long-acting bronchodilators, or perhaps a little bit of constipation. So if you do get any troublesome side effects, again, talk to your healthcare professional. So another type of inhaler we want to talk about with the medicines inside the inhaler is an inhaled corticosteroid. Now, steroids occur naturally in our bodies. Corticosteroids can be given to work on that inflammation on the inside of the airway. So it's not acting on the outside, it's going inside to try and calm down that inflammation. Often, in people with lung conditions, it can be given alongside a bronchodilator. So again, you can have 2 of these medicines in one inhaler, the inhaled corticosteroid and the bronchodilator. So you've got those 2 medicines working on different areas of the airway. But of course, the aim of the medicine is the same. It's to relieve that breathlessness, that tight chest, sometimes that wheeze you can get. But the inhaled corticosteroid can also help with that inflammatory process that you can get, especially if you're prone to infections. Because it's got a steroid in it, the side effects from it can cause a little bit of a dry mouth or hoarse voice, or very occasionally even thrush. So we recommend after using an inhaler with a corticosteroid in it, that you take some water, have a gargle and spit it out so the residual doesn't stay in your mouth. And the last inhaler I wanted to mention was something called a triple therapy inhaler. Now this inhaler's got a bit of all of it in it. It's got an inhaled corticosteroid in it, and it's got both of those long-acting bronchodilators in that inhaler as well. So again, it's something that's going to be fighting the outside of the airway, relaxing that muscle, and it's also going to be getting rid of that inflammation on the inside of the airway. It can be given to some people just to simplify that inhaler regime if they've got 2 or 3 inhalers on the go. But it is something that can be taken either once a day, there's a once a day inhaler, a triple therapy, or twice a day, morning and evening. Again, the side effects, because it's got all of those medicines in it, are going to be very similar to what I've already mentioned. But just a reminder again, it has got that inhaled corticosteroid in it. So remember that after that inhaler, you would also need to gargle out, rinse your mouth, so that you've not got that residual that can cause that dry mouth and that hoarse voice. So that brings us to the end of the inhaler medicines that we're going to talk about in this session. So do remember the short-acting rescue inhaler. You should always have one of them with you, but you're going to have one of the other inhalers that you're probably required to take as a maintenance therapy on a day-to-day basis. That's the medicines and what they do inside the inhalers. But as I mentioned earlier, please do take some time at the end of this session to check your inhaler technique. Because obviously if you're not using the correct technique for the inhaler that you've been given, then that medicine's not going to get into our airways to help them in the way it's intended. The next medication we're going to talk about is via nebulisers. It's nebuliser therapy. Nebulisers, if you haven't seen them, look like this. And there's 2 ways that we can deliver medicine through a nebuliser, either via a mask or a mouthpiece. The medicine, when it's delivered, is in a liquid form, and it's put into this little chamber here in that liquid form. The nebuliser then converts that into a fine spray, which is easily absorbed into our airways. We're quite limited the amount of medicines we can give that way, and often they're introduced when somebody's being extra poorly, they've had a flare-up, they're having an exacerbation, a chest infection, particularly breathless, having problems with sputum clearance, and generally unwell, and a nebuliser can give high doses of medicines to help them when their inhalers might not be working. So they're often introduced in hospitals, and we consider them more of a short-term therapy, and one that if you came out of hospital using a nebuliser and needing one, we would be keen to wean you off of, if we can, back to your normal inhalers. Because if your normal inhaler's working well, you won't need the nebuliser. The most common medicine that's given through a nebuliser is the bronchodilators, the one that opens up that muscle on the outside of the airway, and they're given in high doses. We can also give medicines like antibiotics very seldomly through them, and we can also give saline nebulizers, which is a sterile salt water which can be given when people have particularly thick secretions when they're poorly with a chest infection, that can help them clear them. If you are using a nebuliser long term, they will need cleaning. The whole tubing would need to be thrown away every 3 to 4 months and replaced. And after each session using a nebuliser, the top part of it, the mouthpiece or the mask, needs to be washed and wiped clean. So do talk to your healthcare professional about that if you're needing to use a nebuliser at home. The next medicines we're going to talk about are tablet forms of medication. The first one I'm going to talk about is antibiotics. Antibiotics are prescribed for chest infections when you've got a bacterial infection. Unfortunately, they don't work against viral infections. If they're prescribed, they're usually a short course over around a week. And it's really important to finish the course and not stop it halfway through if you start to feel better. Before starting antibiotics, you might be asked to do a sputum specimen, which is coughing up a little bit of that phlegm that's coming up off of your chest if you're poorly, and sending that away to the lab to just check what infection you've got to make sure the antibiotics you're being prescribed are going to be effective against that infection. Antibiotics can form part of a rescue pack as well. Now we're going to talk in a little bit more detail in a later session about rescue packs that can be kept at home, but it's basically some antibiotics and perhaps some steroids, which we're going to talk about next, that are kept in your home for if you have a flare-up, you're getting poorly over a day or 2, you've had an increase in your usual symptoms, so you're more breathless, you might not usually produce phlegm, but you start producing it. You might feel more short of breath, you might have a tight chest, a wheeze. These can all be signs of a chest infection. And sometimes, as well as talking to your healthcare professional, ringing up your GP or your nurse and saying, I'm poorly, it's nice to have the antibiotics as a standby at home so that you can start them without delay, so they can form part of a rescue pack. It's also quite useful if you have a course of antibiotics for chest infection and they work really well, to make a note of them in your self-management plan, which we're also going to talk about in a later session. And then if you were unlucky enough to get another chest infection, you'd be able to say, I had some antibiotics last time and they worked really well. Could I try them again? So it's worth keeping a note of them. If you are unlucky enough to start getting regular chest infections, it might be that your GP or your respiratory consultant suggests that you try taking a special antibiotic on a longer term basis, on a prophylactic basis, to try and avoid you having regular chest infections. The next tablets we're going to talk about, I spoke about a little before, are steroid tablets. Now, steroids, as I've said before, do occur naturally in our body. When we have a flare-up or an exacerbation and we get that increased breathlessness and that increased inflammation in our airways, steroids are really effective at helping to dampen down that inflammation. So they'll often be prescribed when you're having a flare-up over and above your maintenance inhalers that you still take on that day-to-day basis to help with that. The most common steroid that is prescribed is called prednisolone. It's usually given over a short course of a few days up to a week, but sometimes it needs to be weaned off gradually, kept on for a bit longer to help with your symptoms. Very occasionally, it can be on a longer term basis as well as your maintenance inhalers. Prednisolone in short courses, the steroid, is usually really well tolerated. But like all medicines, it can cause some side effects. The most common side effects it can cause are an increase in appetite, so you can suddenly get more hungry. So we just advise you, just be mindful of that and just keep to a healthy diet and try and keep as active as you can during that period. It can disturb your sleep and make you feel a little bit restless. So for that reason, we recommend you start taking the prednisolone as doses in the morning so that the levels have worn off throughout the day. If you need to take steroids on a longer term basis, then the side effects can be a little bit more serious and can include things like diabetes, thinning skin and osteoporosis. So if you're committed to taking them long term, then do talk to your healthcare professional like your GP, nurse or physio if you've got concerns about the side effects. But obviously we always try as healthcare professionals to weigh up the benefits of taking medication, and you wouldn't be prescribed them if you didn't really need them. The next tablet we're going to talk about is antimucolytics. Now, in an earlier session, we talked about chest clearance and the importance of trying to remove the mucus and the phlegm that can build up on your chest. Over and above that, some people can still either produce a lot of sputum mucus on a daily basis and have trouble clearing it, or they can produce more mucus, more secretions when they're poorly and having a flare-up. And at this stage, these antimucolytics can be introduced and prescribed. Some people keep them as a maintenance dose and then increase the amount they use when they're having a flare-up. For other people, they just need them when they're having a flare-up. They try to reduce the amount of mucus that's being made and also break up the molecules of mucus so it's easier to cough out. The next tablet we want to talk about is amylophylline, also known as theophylline. This is a tablet form of a bronchodilator. You remember earlier, I referred to that tight muscle around the outside of the airway. Well, the theophylline is another way of a bronchodilator relaxing that muscle on the outside of the airway. It's usually introduced for people that have got more severe breathlessness. They're on all the other maintenance therapy inhalers, but they're still getting troubled by quite severe breathlessness. This can be introduced and tried as an add-on therapy. If you are started on theophylline, you may need regular blood tests because the theophylline levels can build up in your blood and can cause side effects. So that's something that your GP or your respiratory consultant would talk to you about if you're needing to start them. But that's another way of giving bronchodilator, but it's often something we use as an add-on therapy when you've already tried the other inhalers and you're still having problems. The next medicine I wanted to talk to you about is oxygen therapy. So oxygen will only be prescribed for you under careful conditions when you've been properly assessed by a healthcare professional. There's two ways we generally give oxygen. One is called long-term oxygen therapy, and that's for people with that low level of oxygen called hypoxia. They've got consistently low level, so we introduce oxygen to support their lungs and also their heart. It's given maybe for 15, 16 hours a day. So it's a long-term oxygen therapy that they're going to need to use each day to correct that low level of oxygen. The other way we can give oxygen is called ambulatory oxygen therapy. And that's somebody that may not be hypoxic, low of oxygen on a day-to-day basis, sitting, watching telly, sleeping. But when they get up and they think, right, I'm going to go to the shops, I'm going to do some gardening, playing with grandchildren, whatever you like to do, for some people, their oxygen levels drop at this stage and they become more breathless and they can't do as much as they want to do for as long as they want to do it. If you're found to have oxygen levels that drop at that stage, then we can introduce ambulatory oxygen to help you while you're mobilising around. But it's not something you need when you're sitting watching the telly or sleeping. It's just for short-term use when you're going around. It can also be introduced sometimes if you get really poorly and you need to go to hospital with a chest infection. If your levels at that stage where you're fighting a nasty chest infection drop and you become a little bit low of oxygen, it might be something you're given in hospital just to make you feel better, but don't go home with. Oxygen is obviously dangerous. It's a bomb if it is introduced with a cigarette. So we don't ever give oxygen to people that haven't managed to give up smoking or people that have smokers in the home. If you needed oxygen and you did need it, but you're still smoking, we allow a 6-month gap between stopping smoking and being given the oxygen, just to make sure you've really managed to kick that habit before you start the oxygen. The next medicine I just wanted to talk about was nicotine replacement therapy. So if you're a smoker, I know you've probably been told this, but smoking continues to damage your lungs. So I would never want you to think, if I still haven't managed to give up smoking, it's too late now. It's never too late. In a cigarette, there's over 5,000 chemicals. And of course, when we smoke, all of those chemicals go over our body. And as well as making our lung condition worse, they can increase your chances of diabetes, of stroke, of cancer. Nicotine replacement therapy is one of those chemicals in the cigarette, called nicotine. It's a really addictive chemical that works on our brain and gives us that urge to pick up another cigarette. It's highly addictive. And sometimes if we can introduce nicotine at a controlled level through a tablet, nicotine replacement therapy, it stops you wanting to pick up that cigarette. So you've not got all of those chemicals going over your body, and it really can help you to give up. I'm talking about tablets, but nicotine replacement therapy also comes in lozenges, in inhalers, in patches, all sorts of different ways of taking nicotine replacement. And it can really help change your mindset and think, I don't want that cigarette, because you're already getting that nicotine. It's really effective if it's part of a smoking cessation program where you get some support. And we've got the details here of Smoke Free Hampshire, which is our local service. If you're at all interested in giving up or would like to know more about nicotine replacement therapy, then please do give them a ring or talk to your GP, nurse, physio, your healthcare professional. We can all help you and give you some advice, but the Smoke Free Hampshire are the experts that can really give you that counselling, that support to see you through. And they say about 4 times more likely to quit if you get Smoke-Free Hampshire involved than if you try to go it alone. If you go through Smoke-Free Hampshire, they're also able to prescribe these nicotine replacement therapies for over a 12-week period free of charge. So they're really worth talking to. So in this session, we've talked at the beginning of this session about inhalers, and we've concentrated on the medicines that can be delivered through those inhalers and what they can do to help the lung condition. What we haven't talked about is the inhaler device. If the inhaler is not taken in the right way, the medicine can't get down into our airways and the lungs where we really need it. So inhaler technique is incredibly important. No matter what medicine's in that inhaler, it's not going to work if it doesn't get to the right place. In actual fact, it can increase your symptoms if you don't use the correct inhaler technique, because you can imagine it's not getting into your lungs where it's needed. It can increase your chances of having flare-ups, exacerbations. It can even increase your chances of going to hospital. So it's really important to check your inhaler technique. It's worth getting to know your inhalers and getting to know the different devices and the proper inhaler technique for each individual device. I'm going to just briefly talk about the main differences between the inhalers, because actually, although there's lots of colours and shapes and different medicines in the inhalers, it actually boils down to 2 different types. There's something called a pressurised metered dose inhaler, which is an aerosol generated inhaler with medicine in it that needs a slow and gentle, slow and steady technique. And there's a dried powder inhaler that requires much more deep, forceful inspiration to get it from that inhaler into our airways. So that's the 2 I want to concentrate on. So it's really important you get to know whether you've got dry powder inhalers, metered dose inhalers, MDIs, or whether you've got a mixture of both, and what inhaler technique you need to use correctly for each device. If you're at all unsure, please do talk to your pharmacist, your GP, nurse, physio about which one you've got and how best to use them. And if you find it a bit confusing if you're unlucky enough to have the MDI and the dry powder inhaler, and you think, oh, I can't remember which technique I'm meant to be using, then you could ask your healthcare professional, your GP or nurse or physio, if you can swap to the same sort of device for all of your medicines so you know exactly what you're doing. It's really important as well, once we've checked the technique today, just to revisit that every few weeks, every few months, just to check, because with the best will in the world, we can all get into bad techniques. And it's really important with this to keep to the really good technique so that medicine gets down into our airways. It's also worth just looking at the inhaler device and thinking, where's the expiry date on there? Because they've all got one. How do I know that device is empty? These are really important things just to know. You can imagine you don't want to run out of medicine. So if you look at the device and you're not at all sure, please do talk to a healthcare professional. So first, let's talk about an MDI, a pressurised metered dose inhaler. It comes in lots of different colours, but essentially it will look like that. It's got an aerosol component to it, which has got the medicine and a propellant in it, and it goes into that container where it's administered from. Check the expiry date. They usually come with a lid, and it's quite good to keep that lid on, because you can imagine if you get little particles in there, you can accidentally inhale them, and that can get dirty as well. So to protect it, keep the inhaler cap on. Alongside this, we've introduced aerochambers. They're tubes that you put the inhaler in, and they slow down that medicine because it propels out of here really quickly. And what we want to do is coax it down our airways so it goes down really effectively. So although you can do it like that, we much prefer that you put it in an aerochamber. So this MDI has got the propellant and the medication in it. So the first thing to do is to give it a really good shake before you go to use it. Shaking up that medicine and taking off the cap and just checking that there's nothing in there, that it's clean, that you're not going to accidentally inhale anything else into your airways. Then I would suggest putting it in an aero chamber because that's going to slow it down and more of it's going to go in your airways. I'm slowing this down just to talk through each step, but then you want to breathe away and you want to make sure your air is empty, your air is out of your lungs so that you can take that nice, slow, steady breath in. So I've shaped it, I've put it in there, I've opened the cap and I'm breathing out. And then I'm going to put my mouth around there, get a really tight seal, press the medicine once and take a nice slow breath in. It's also important just to tilt your chin a little bit so you've got a nice open airway when you do it. Then when you've taken that maximum breath in, hold your mouth closed, keep that air in, don't breathe out for about 5 to 10 seconds if you can, or as long as it's comfortable. So should we go through that and do a demonstration now? So I'm giving it a shake. It's in there. I'm blowing out for 5. So you can see there I tried to do it in counts of 5. I breathed out for 5, sealed my lips around, nice slow breath in for the count of 5, and then held my breath for 5 to 10 seconds as long as comfortable. If you need to do another dose, take the medicine out again, the inhaler out, give it a good old shake again before you do that second dose. I should also mention the aero chamber is quite a clever device in that it will tell you if you're breathing in too deeply and too forcefully and heavily. It will whistle and you don't want to hear the whistle. So if you hear this, it's saying slow down, you're doing it too fast, you're going to hit the back of your throat and you're not going to take that medicine down your airways, so slow it down. The trick with this technique is slow and steady. I should also mention that as well as that aero chamber with a mouthpiece on it, there is an aero chamber designed with a mask on it. And the masks come in 2 different sizes, so for those larger face people or the smaller face people. So do find a mask to fit you. It's the same technique, it's still got a whistle on it, but it's a really good way of getting that medicine in your lungs if you have trouble getting that nice tight seal with a mouthpiece. There's one more way we can use this aero chamber that can be particularly effective if you're having a really bad day and you feel particularly breathless. Because this is a holding chamber, you can take your medicine, exactly the same preparation, you give it a shake, you breathe away, my lungs are empty. I'm sealing around, pressing it, but then I'm just going to take 5 gentle breaths in and out of this without getting the whistle. And that's called the tidal breathing method. And that's another good way of getting the medicine into your lungs if you're not able to take that long, slow breath in. But if there's a situation where you haven't got an aero chamber and you need to use your inhaler, just remember to do it slowly and steadily, gently, because it fires out there quick and you need to slow it down. You don't want it to stick to the back of your throat. You want it to go down to your airways. That's your MDI. That needs the slow and steady technique. Okay, so the next device I wanted to talk to you about and show you is a dried powder inhaler. Now there's lots of dried powdered inhalers out there on the market in all sorts of different shapes and sizes. But all of them, even though they might have slightly different medicine in them, they all need the same technique. They need a deep, forceful inspiration. Because in that inhaler is a powder and it's only going to get into our airways if we do that deep, forceful inspiration in to get it from there into here. So I just wanted to demonstrate a dried powder inhaler to you. Once you check that you've got that device, you open up the lid, and as I say, the lids all vary slightly. Just check the mouthpiece is clean, there's no debris in the way, there's nothing you're going to accidentally inhale. Then the same preparation, I need to empty my lungs because what I want to do is take a nice deep forceful inspiration to get that medicine into my airways. So I'm going to breathe away, and I again use the count of 5. So I'm breathing away for 5. And again, for this one, you want that nice, clear, open airway. So you don't really want to be doing it like that. You want to open up your airway as much as you can to help that medicine go down. Some of the dry powder inhalers have also got vents on them, and it's best to not put your hands over that vent. So keep your hands away from the vent. And at the stage when you've opened the inhaler and you've got that powder in there, it's never a good idea to tip them upside down as well, because the risk is that you might lose some of that inhaler. So once I've got that nice clear open airway, I need to take that nice deep forceful breath in, and once I've taken that maximum breath in, I need to hold it so it has the best chance of going down into my airways. So I'm breathing out. And again, I like to do it in counts of 5 because that works well for me, but whatever works for you, as long as you remember it's deep and forceful that you need to get that dry powder inhaler into your lungs. So thank you for listening. That concludes this session on medicines. I hope you found it interesting. On this slide we're looking at now, you can see really useful websites, and I know you've heard this before. The British Lung Foundation, a fantastic website with lots of useful information on it. The asthma.org website I can really recommend. You might be sitting thinking, well, I haven't got asthma. But just for the inhaler technique, they've got some fantastic short videos on there that you can just go to the inhalers. They've got lots of pictures of different inhalers. You can click on the inhalers that you've got and you can double check your inhaler technique on them. So I really recommend them. And the other one, of course, is Smoke Free Hampshire for those amongst you who might be struggling to stop smoking. Any questions? Please speak to one of your healthcare professionals, but it's been a pleasure being with you today.